Hi, my name is Dixie. I'm from Covina, California, and I've had a lifetime of problems. I've had nothing but antibiotic as a child for sinus infections, and I constantly had bouts with hives, and so I was just not of good health. My late teenhood, I had had mononucleosis, chickenpox, which was very hard on my system. Then I had my wisdom teeth removed, and I got a case of iritis, which is inflammation of the iris of the left eye, and almost went blind. And the treatment for that was months and months of cortisone. So my system kept going down and down based on the treatment for these illnesses. Eventually I finished college. I got married, had eventually 5 children, and I homeschooled my children, but I was always sick. I had had multiple surgeries, 3 C-sections out of 5. I had injured my leg, and with a...
36 surgery?
I had multiple surgeries. Some of them started when I had injured my leg with a X-Acto blade and had vascular surgeries. I also grew had polycystic ovarian syndrome and grew adhesions all the time internally, and I had 10 laparoscopies where they would distend my abdomen and go in and cut the adhesions, and so my abdomen hung over by multiple inches. It distended forward and hung over, so eventually I had a whole tummy tuck done, but none of the feeling was back into my abdomen, and I had multiple bladder slings. I had interstitial cystitis, which was like small perforation in my bladder, so it burnt all the time. I had the adhesions that were growing internally were always giving me abdominal problems. The medications were always causing additional problems, and I had gastrointestinal problems up a wazoo. I had kidney stones up a wazoo. I don't even know how I kept functioning every day, but I just had to keep going. By the time I showed up at Dr. Tong's office, because I had heard him on the radio, I had had 36 surgeries. I had them on all my limbs, my hands, my arms, my legs, my gastrointestinal. I had had a hiatal hernia surgery, you name it. I had been diagnosed with an autoimmune disease, Hashimoto's thyroiditis, where my own antibodies were killing my thyroid. I had fibromyalgia. I had chronic fatigue syndrome because they slapped those names on my broken system. I had, like I said, interstitial cystitis, which was the ulceration of the bladder. Polycystic ovarian syndrome. I came here taking 2 thyroids, all these additional hormones on top of it because they were trying to substitute for the thyroid not helping me produce hormones. I had medications for interstitial cystitis, which included putting a medication up into my bladder. They wanted to do it on a daily basis, every couple days. I had already gone through DMSO treatment where they put this burning acid up into my bladder, and I reeked like garlic for days in an attempt to heal a problem. It did not heal it, it made it worse. I finally could not take the instillation anymore of the medication through a catheter. It caused all kinds of problems going in. I was on a medication for that would make me have a sticky platelet problem in my blood because it was a type medication to coat the bladder, but it coated systemically everything else. I was not getting healthier. I was also on all kinds of sinus medicine and asthma medicines, 3 different asthma Advair, Singular, 2 other puffs that I needed for asthma. I stopped them from eventually putting what was it, type lung disease. I was tired of all the diagnoses being put in my charts, and if I wasn't a teacher, by the way, I was off work at that time because I had so many complications, and it was very hard to function. I had been to a fibromyalgia specialist who put me on guaifenesin, and so I was on that, but that helped with the sinuses. But I was always on antibiotic and any kind of the newest antibiotics. I was on I had got an infection from a colonoscopy, those special procedures they want you to have every year. And the doctor actually perforated my colon, so I had a type peritonitis and was on multiple weeks of antibiotic after the hospital stay in the Rocephin in the IV for a week. Everything was assaulting my system, and all the American
Medical Association.
Thank you. All the AMA had to offer was more surgeries. I was up to 36 by then, and more medication, and that was it. Now, one time early in my 20s, our whole family had a horrible 3-month bout with sinus flu, and nothing was helping. I had been on every antibiotic that existed at that time, and I was already allergic to penicillin, so I had to use anything and everything that was coming out on the market. I was like the guinea pig for the new antibiotics. But anyway, nothing was working, and my sister suggested I go to an acupuncturist, which I did, and in 1 hour of acupuncture, my sinuses were cleared, and I was recovering, and I got over that illness. Within that day, I was over this 3-month sinus infection, and I remembered that it happened, in my 20s. So when I heard Dr. Tong on the radio, I thought, I'm just going down. I could barely function and get up every day. My life was falling apart on raising kids, my marriage, everything was falling apart. I couldn't function. And I heard Dr. Tong on the radio, so he cracked a few jokes. I thought that was funny. But it was just something different, and I already known that acupuncture had helped me years earlier. And you'd think I should have kept up with it. But I was to that point, I put a lot of faith in the American doctors. I kept thinking, okay, this one knows this one knows this, and I would go one to another to another. I put my faith and my hope in these doctors. And they all had wonderful intentions. I'm not knocking any of them. They all had wonderful intentions, but my system was just broken down. There wasn't anything anyone could pile or cut into me and get any more results with. And so I showed up to Dr. Tong's, and he took me off all my medications right there. He said, quit them all. And started treating me with his method. It's not, besides acupuncture, he has another method he's devised. And I was shocked at how much better I felt with the very first treatment, that I could even function and keep going. And I couldn't even imagine going off these medications he had me going off, and I just could go off them, and I kept functioning. I only had one treatment a week because that's all my insurance would cover.